Good afternoon, and thanks everybody for joining us. Thank you, Liz. You know, as much as we would like for COVID to be over, we're not quite done. Sure, we've made a lot of progress, but we're still seeing a lot of cases and unfortunately a great many deaths. Today, we reported 11 deaths, all of whom were unvaccinated or undervaccinated. 10 of them were totally unvaccinated, and one of them was partially vaccinated. 3 of the deaths were in their 30s, and we are seeing this more and more cases in younger middle-aged folks who are undervaccinated. In addition, we're seeing an increasing number of cases, in large measure due to the Delta variant, and we are starting to see an increase in the number of hospitalizations. Please know that the vast majority of these cases and hospitalizations and deaths are in the unvaccinated. Let me make it very clear. The vaccines are saving lives. 96% of our cases over the past month, unvaccinated. 95% of our hospitalizations the past month, unvaccinated. 90% of our deaths in the past month, unvaccinated. We're starting to see that the median age of most cases is going to be in the late 20s to early 30s. So it's this younger age group that we're going to struggle with, but we still have too many older and vulnerable people who are unvaccinated. COVID's not gone, and sadly, we're going to lose more folks. Please know that COVID vaccines are widely available. Go to vaccine.gov or go to our website or covidvaccine.umc.edu. It's more abundant and available than everywhere and also anywhere, anytime. And also we're working with private docs to give them small allotments of vaccines so that they can have them available in your clinic. So please talk to your doc and get vaccinated. We know that the vaccines are safe, effective, and do save lives. This is well demonstrated in the statistics on the number of cases, hospitalizations, and deaths. This is something we're going to see more of as we go through the next few weeks, with the Delta variant becoming the predominant strain within our state. And as we approach the 4th of July, we do hope people can show some moderate behavior. Try to do stuff outside if you can, primarily, especially if you're around folks who are unvaccinated or undervaccinated. And if you haven't gotten it yet, now's your time. Thank you, Liz. I'll kick it back to you.
Thank you, Dr. Dobbs. Dr. Byers, I want to talk a little bit more about the Delta variant. How many cases do we now have in Mississippi?
Thank you, Liz. And I'm sharing a screen, and I just want to kind of build on what Dr. Dobbs indicated as well. We do have 78 cases of Delta variant that have been identified in Mississippi. This is a highly infectious variant strain. It is even more infectious than the Alpha variant or the UK variant that we were concerned about earlier, some weeks ago, which we still see a lot of in Mississippi right now. But the Delta variant is of particular concern because I don't think we have everybody on mute, is of particular concern because of how highly infectious it is. And I just want to illustrate how, in particular, Mississippi is vulnerable to this highly infectious variant. When you look at our population rate, our vaccination rates compared to the US, you can see that we are considerably lower across all age groups. If you look at the percent of our total population that's been vaccinated, just a bit over 30% of Mississippians are fully vaccinated now. When you break it down to individuals over the age of 12 and equal to 12, and remember who's eligible for vaccine now, it's 12 and older, you can see that we are some 20 percentage points behind the rest of the population in the US. When you look at the percent of population 18 and older, you can see how we stack up to the US. We are still considerably lower. We've done a better job of vaccinating our individuals over the age of 65. And this is encouraging, but we still have a long way to go because we are still seeing deaths in vulnerable folks over the age of 65, even though we're starting to see more of that occurring in younger folks now as well. And so, like I said, we've seen 78 cases of the Delta variant in Mississippi. Remember that the emergence of these variants is occurring frequently now. And when you have a variant strain that is more highly infectious, certainly you run the risk of seeing much more transmission. And what we're seeing now is most of the cases have been identified in the Jackson metro area so far. A bit over 80% of those cases have been in the Jackson area. We are seeing outbreaks of the Delta variant occurring among elementary age school kids, high school age school kids, middle school school kids. We're seeing it associated with camp settings. We're seeing outbreaks in congregate settings. We have seen an outbreak of the Delta variant in a personal care home. So this is very infectious. And one of the things that we're seeing about this is that when we identify a case and we do our case investigation, we are finding several cases of secondary and tertiary transmission of those cases being transmitted down the line. And one of the real problems when you have a highly infectious variant, especially in a congregate setting, is that you can have some cases that occur in fully vaccinated people. And we have seen that in some congregate settings. Now, the good news is even when we've had these vaccine breakthrough cases, by and large, these individuals have been protected against the severe outcomes that can occur as a result of the infection. So, we're not seeing as sick people. They're having mild to moderate or no symptoms in some cases. But the real concern is that as we have this spread of this Delta variant among unvaccinated people, we do run the risk of having some cases bleed over. And so it is incumbent upon us, the way that you combat the variants, the way that you combat the transmission is to get vaccinated. This is especially important for healthcare workers. It's especially important for staff and employees in long-term care settings, because even though our staff and our residents in those settings are highly vaccinated, we need to protect them. And the best way to do that is for all the staff, all the healthcare workers to be fully vaccinated to prevent that transmission that may occur in those settings. We, as Dr. Dobbs said, we've seen a modest increase in our hospitalization numbers. Certainly, we are looking at potentially some modest increases in our overall case numbers on a daily basis. I think that when we get to interactions in the 4th of July, that we may see some increased cases and hospitalizations after that if we're not taking the proper precautions now. And so, again, the vaccines are available. We need to utilize them. We don't need to leave this tool on the table. We have an opportunity now before school starts to get our young children vaccinated who are eligible, to get teachers and staff and to get healthcare workers vaccinated. The way to beat this, the way to interrupt this cycle of continued concern over variant strains that are highly transmissible, that can lead to more cases, hospitalizations, and deaths, is to get vaccinated and utilize the vaccines that we have currently. So, Liz, I think with that, I'm gonna turn it back over to you, and we can open it up for questions.
Okay, thank you. Members of the media, I want to share with you, and I've shared this before, I don't have the ability, and I've talked to all our technicians, I don't have the ability for you all to directly record it. If I did, we would do it. That's why we record it and put it on our website, and I'm sorry for any inconvenience, but I just want to get you all the information you need. And I'm sorry for the technical difficulties in the beginning as well. And also, one more thing, if we email you and ask you who you're affiliated with, we need to get a response. Okay, so let's see. Y'all politics. There's been a lot said in the media and by public officials about the COVID variants, and particularly the Delta variant, and that the threat that it might pose. So I have a couple of questions. First, the Delta variant infection rate, according to MSDH, went up 162% last week. I put my glasses on here, but 60 of the 78 cases of the Delta variant were located in Hinds, Rankin, and Madison counties. That's a very good point. Is the Delta variant something that all Mississippians should be concerned about? Let's start there. And the answer to that would be yes. Or is there something attributable to just those areas that are cause for the most concern? So Dr. Byers, explain how we do our sequencing and how we ascertain that something is a Delta variant. It's obviously throughout the state, not just in those counties.
Yeah, I think, right now where we've identified it so far is predominantly Hinds, Rankin, and Madison counties, but we have identified it in other parts of the state as well. It certainly is a concern for the entire part of the state. I don't want to mislead folks and think that it's just a Hinds, Madison, and Rankin problem. It is not. We anticipate that we are going to see transmission throughout all parts of Mississippi, and that one of the things we do with our surveillance is we elicit samples from providers to perform sequencing at the Department of Health or at some of our laboratories that we have partnerships with. And right now, many of the samples that we receive are from the metro area. So those are the ones that have been sequenced. But again, we've identified this variant in multiple parts of the state. We anticipate that, just like CDC said that we anticipate that this is going to be the dominant strain in the US, we anticipate the same for Mississippi.
All right, thank you, Dr. Byers. Anna Ferris with WJTV. Should folks be getting boosters to prevent against the Delta variant? Also, where are we with younger folks being vaccinated, and would it be required in the future to get students and teachers vaccinated? So let's take this one at a time. Dr. Dobbs, why don't you handle the booster part?
Yeah, no, thank you for that question. Fortunately, it looks like the vaccines have really good protection against the Delta variant. So that's really good. And there's new data out that shows that the vaccines, especially the mRNA vaccines, have long-lasting protection. So in general, we don't think that there's a need to consider a booster just for the Delta variant. Now, there are some caveats in there that I think are worth mentioning. We do know that people who are immunocompromised, cancer patients on medications or transplant patients, will have a significant likelihood that the vaccine will not work for them in the normal series. So it's important for folks who are immunocompromised, even if vaccinated, to exercise caution and talk with their doc. We have seen some docs who've checked for immunity through blood work and then given a third dose, kind of off-label, and we don't have any. We've seen some studies that showed that might be worthwhile. The same thing, other question that's come up about the Johnson & Johnson vaccine. Should you get a different vaccine with Pfizer or Moderna after Johnson & Johnson? There was a study recently in The Lancet that showed that those who had the AstraZeneca vaccine did better if they had sort of another dose of the Pfizer vaccine. That's still out there. We don't have any recommendations ongoing, but I think it's something we need to follow closely. And again, I think this is one of those things that falls in the realm of the patient-doctor relationship. And if there's a situation where someone does need an additional dose, as an off-label indication, it's not something that we're discouraging.
And Dr. Dobbs, that second part of the question, would it be required in the future for students and teachers to get vaccinated? We encourage vaccine for everybody that is of age. And I know we're going to be doing testing in the schools. Is there a chance that could be required in the future?
We don't see any likelihood that we're going to mandate vaccines for teachers or students. I mean, we'll see what happens going down the road, but I wouldn't anticipate that being a mandate.
Okay, thank you. And Brendan Hall with WLBT, and this is a really good point. The former FDA commissioner recommends getting vaccines into the hands of doctors so they can more easily supply doses in their offices and encourage their patients to get vaccinated. That's exactly true. That's an effort we are working on right now because we know a lot of people want to get the vaccine from someone they know. His reasoning is that people who would be convinced to get vaccinated from people like Dr. Fauci and or you guys are likely already vaccinated. Is this something you guys are working on here in Mississippi? So Dr. Dobbs or Dr. Byers, one of you, talk about what Dr. Dan Edney is doing in some of our efforts with providers to make providers more widely available with vaccine.
Let me go ahead and say to begin with, we've included docs from the beginning, right? We've always had private doctors, and we recognize that that was an important part of their role. Certainly there were logistic challenges early on. The minimum order for Pfizer was 1,170, and you had to have a -80 freezer. So those were really steep impediments, but we've made a lot of progress on that in that we are continuing to ship vaccine to private docs. We're trying to recruit them. And we also have a DPRO program where private clinics can pick up as few as 6 doses in a single vial of Pfizer, and they can put it in a refrigerator for 30 days. So we have been working aggressively to make it more available. And I'll kick it over to Dr. Byers to talk about other efforts to recruit more docs into the fold.
Yeah, and so we have, and you know, we've worked with providers and physicians since the very beginning. And you know, one of the things that we encourage providers now is to not only take advantage of receiving the smaller distributions of vaccine, especially the Pfizer. You know, we're able through our depot system, like Dr. Dobbs had mentioned, to be able to provide as small increments of as 6 doses for providers to use in their primary care or in their point of service model. And that really is something that we've been encouraging for several weeks now, is that we want providers to be the source of that vaccination and the source of truth and guidance for their patients, because we know the impact that that can have. We additionally encourage providers to have the vaccine on hand and utilize our resources to be able to receive those smaller dose increments. And when a patient comes in and they work with them and they want to get vaccinated, to get them vaccinated at that point. We're at a point where we have plenty of vaccine now. We don't want a provider to miss an opportunity to try to round up 6 other patients or 5 other patients to get that individual vaccinated. We want them to take the opportunity at that point in time to vaccinate. So let's don't miss opportunities. We're encouraging providers to look at their patient list, to identify those individuals that have not been vaccinated and help facilitate getting that vaccine. And we are spreading that word out through multiple organizations that we already work with and have established relationships. So we continue to work with state medical, with the American Association of Pediatrics, the Mississippi chapter. We work with the Family Medicine Group. And so we're going to continue to get that word out to providers so that we make them understand that this is at the point in time now where we need it to be person to person getting that vaccine.
Thank you, Dr. Byers. And also the CDC has come out and said, we want to put shots in arms. Don't worry about waste, worry about getting vaccines in arms. Is that correct, Dr. Byers?
That is correct. And that's a message that we say as well. Let's don't worry about as much the wastage. Let's worry about getting a shot in an arm, because a vaccine does us no good sitting in the freezer or the refrigerator.
Okay, thank you. Okay, hi, Sarah. Sarah has a lot of questions from the Clarion Ledger, so we'll just take them one at a time. All right, Sarah's first question. In the past month, there's been a 15% increase in COVID-19 cases. What do you all make of this increase? Solely variants? Does Memorial Day have anything to do with the spike? Do you believe it could continue to rise as vaccination rates stall? Dr. Dobbs, why don't you take that?
Yeah, you know, it's probably multiple factors. The Delta variant certainly is a big one. We look at what's going on. From my conversations with Dr. Byers, we're seeing more and more outbreaks in youth settings. And that certainly seems to be driving a lot of the cases if we're talking about, like, you know, summer camps or like cheerleading camp and that sort of thing. So I do really think that the Delta variant is driving a lot of it. We still have far too many susceptible people, especially in the young to middle age ranges that's going to continue to be a vulnerability for us. And Dr. Byers, I don't know that I could really detect much of a rebound after Memorial Day per se, but I definitely think the Delta variant is a big driver. And Paul, anything you want to add?
No, I agree. We didn't see much of a bump after Memorial Day. I think it's like you said, it's a number of factors. I think it's our low vaccination rates. I think it's the fact that we're seeing more highly infectious variant strains that are emerging and being identified in Mississippi. And I think that, in large part, we have people who are unvaccinated that have gone back to business as usual with large group settings where when you intermingle in a large setting with a bunch of unvaccinated people, all it takes is one or two people to transmit infection.
So then the last part of Sarah's question, as vaccination rates stall, yes, we would continue to see a rise in cases. Would you agree with that? Okay. All right, Sarah's next question. Since the department's website data on COVID-19 related deaths span June 2nd, 2020, after cause of death is identified on death certificate, is there a more real time we can know of these deaths? Okay, so Dr. Byers, explain that whole process with how we identify deaths and how sometimes we get them later from a death certificate.
Yeah, I'm not certain what's meant by real time, but we report the deaths as we verify them and they're reported to us. And so we receive reports of cases of deaths through a number of different ways. And certainly we encourage all providers and facilities when they identify a COVID related death to let us know about that immediately. But that's not always the case. And sometimes, we get those through vital records or death certificates. And we do review those reports on a frequent basis. When we identify reports that may be related to COVID, we do further investigation and determine whether or not that death is associated with COVID. And then as soon as that determination is made, we report it out. So there's going to be some inherent delays in the system that are unfortunately unavoidable because of the process that it takes.
Okay, and let's see, she says, we're wondering with variant cases multiplying and case count increases, if death rates will increase, especially among young, unvaccinated and elderly folks. So I think we touched on that, Sarah, during the press conference. If we didn't answer everything you needed, then just write me back. All right, question number 3, 90% of coronavirus related deaths are in unvaccinated residents, just like the rest of the nation. Yeah. So are there specific markers in the 10% who are vaccinated but have died from COVID-19 related causes? Or is that 10% partially vaccinated residents? Which gentleman, Dr. Dobbs, you want to take that?
And I'll let Paul come back, but it tends to be folks who are older, vulnerable. We did have a cancer patient who had died. Again, we talked about how cancer patients might not respond to the vaccine in the same manner. So it really seems to be more in the vulnerable folks. And as I recall, looking at the data, young vaccinated folks are very well protected, which is not surprising.
Yeah, when you look at our vaccine breakthrough deaths that we've had, and it's not a lot, and certainly when you look at it compared to their overall number of deaths that we've had, well over 7,000 in Mississippi so far. These are in individuals who are 50 and 60 and older, and typically have a lot of underlying chronic medical problems that make them more vulnerable and put them at higher risk. And so really the way that we protect those folks is the way that we need to protect them all the way around. And that is, if you interact with somebody who's vulnerable, if you live with somebody who's vulnerable, if you take care of as a healthcare professional, it's somebody who is vulnerable because of underlying medical problems, certainly you need to get vaccinated yourself. That's how to prevent those infections in them. And these are not partially vaccinated folks. Those people are really considered not fully vaccinated. So, if you've only had one dose, you're not fully protected. You're not fully vaccinated.
Thank you. And I'm not sure I understand this next question from Rich Mendez at CNBC. Was the person who died and was partially vaccinated in their 30s, or were the 3 people in their 30s among the unvaccinated? How old was that partially vaxxed person who died?
I understand it, Liz.
Okay.
All 3 of the people in their 30s who died were unvaccinated, and the partially vaccinated person was in their 80s.
Okay, thank you. Thank you. Okay, so Rob Lane from MPB. Today, Governor Reeves says he supports vaccines, but emphasizes it should be an individual decision. Quote, I don't think, like some of the public health experts, that I'm smarter than every Mississippian. Is that an appropriate message? I am not aware. I didn't hear this today. And so I'm leery of commenting on something the governor said when we didn't actually hear it. Did either of you guys hear this?
No, but the governor's been a strong supporter of vaccines and certainly appreciate that.
Right.
He recognizes, as do other leaders of the state, that that's our best way out of this, both for health and for economy. I mean, the one thing I do want to just emphasize is, we have a lot of Facebook scientists these days. I don't have any business trying to fix my transmission, right? Nor would I be expected to. And, we've been doing this for a long time. And so we would hope that you would talk to your doctor, people who are health professionals, to make these decisions. If you have questions, ask questions of the people who are the experts in the field. So ask your doc about it if you have detailed questions that you can't find elsewhere.
Okay, thank you, Dr. Dobbs. So Brendan Hall is saying a BBC article cites a study that shows mixing and matching vaccines like Pfizer and AstraZeneca, for example, provide strong immunity. What do you make of this, and could it provide more flexibility with vaccine rollout or future booster shots? Dr. Byers?
Yeah, I mean, it's certainly some encouraging data. We have plenty of vaccine now, and the availability of the vaccine for a second or potentially even a third dose does not appear like it's going to be a problem. Will it make it simpler if we're providing everybody with a mixed third dose if it comes to that? It certainly might, but I think it's speculation at this point. I think this is the beginning of the data that supports that certainly this mixed vaccination may increase immunity. But I think we are a long way from a recommendation from FDA to utilize that, and that's where we would fall in.
Okay, thank you. Dr. Dobbs, did you have anything you want to add to that?
No, that's good.
Okay, Craig Ford is asking, would you recommend people to follow the recommendation issued by the Los Angeles County health officials yesterday that people wear masks in indoor places regardless of vaccination status because of the variant? So Dr. Byers, you talked about some guidelines there. Do you want to answer that?
Well, I think it's important for those people that we've talked about, and Dr. Dobbs mentioned a few of those people, the people who are potentially immunocompromised because of either an organ transplant or medications or a condition or cancer treatments that they're undergoing. We know that they may be more vulnerable even after being fully vaccinated. So I would recommend caution in those individuals. I would recommend that if they're in an indoor space, especially in a large group with unvaccinated individuals, that they should consider wearing a mask and doing extra precautions and being very aware of the risks around them, because we have seen vaccine breakthrough cases and deaths, especially in the most vulnerable of our population.
All right, thank you, Dr. Byers. Steve with Super Talk. Is there any increased risk of unknowingly being a carrier of the Delta variant, even if you're vaccinated? Also, I missed the first part of the Zoom. We'll have that on our website for you, Steve. And if you have any questions, you can just call me. But as far as, is there any increased risk of unknowingly being a carrier of the Delta variant, even if you're vaccinated? Dr. Dobbs?
Yeah, so We do know that not everyone will not have any viral replication if they're vaccinated, right? So we know it's like 95% effective at preventing illness, almost 100% for most folks preventing death, with a lesser amount for asymptomatic shedding. What we do know, though, at the level of it so much lower, that you're much less likely to be contagious. So, I mean, it certainly is a possibility. It could have happened with the previous variants as well, just based on how the vaccines work. But you are far less likely to spread it either because you don't have it or because the viral load is so low because your immune system fights it off so quickly and effectively after you've been vaccinated. The only other thing I'll say that we did mention before is we're just trying to really emphasize that those who are dying, those new cases and hospitalizations are really among the unvaccinated. I don't know, some mythology is floating around that that's not the case. 90% of our deaths are in unvaccinated. 96% of our cases unvaccinated. 95% of our hospitalizations unvaccinated. The vaccinations are saving lives. They're saving dollars. They're saving people having to go in the hospital.
Okay, thank you, Dr. Dobbs. The takeaway there is get vaccinated. Let's see, Hunter Dawkins with the Gazebo Gazette. Should children under 12 use masks indoors, Dr. Byers?
Well, certainly the CDC recommends that if you're indoors with large groups of people and are unvaccinated and you're around among other unvaccinated individuals, that certainly you should wear a mask. And I would recommend following CDC's guidelines. They actually have, a good little setup that tells you when a mask is recommended for when you're vaccinated or unvaccinated. And I think that that's going to be our best source now. But I tell you, we're seeing transmission that's occurring at all age groups, and so far we have seen quite a bit of transmission of this Delta variant among younger folks who are interacting with each other.
Thank you, Dr. Byers. So Craig Ford is asking, what's your response to someone who says he or she does not need to be vaccinated because they have natural immunity after having COVID? We still want them to get vaccinated, Dr. Dobbs.
Yeah, so just to be honest, they probably do have some residual immunity, right? If so, I mean, one of the challenges is we have a lot of folks who think they had it and they think they're immune and they're not. So you certainly want to make sure that person will actually diagnose. If you're younger, you probably will have a longer durability of that response, but it's not going to be as good with the vaccine. The vaccine actually will boost your immune response. It'll be more robust. It looks like the vaccine-induced immunity is stronger than natural immunity. So there is great benefit to getting the vaccine, even if you've had COVID before.
Okay, Dr. Dobbs, some folks are saying they're not seeing you, they're just seeing the mountains.
It may well be on speaker view. I see me just fine. You may have to pin me. I'll pin myself.
Okay, Marvin, can you work on that, please? Okay.
Turn the camera on.
I'm sorry?
Turn the camera on.
Okay, turn his camera on.
He can't. He just
My camera is on.
Okay, well, then Marvin's coming to work. Again, I apologize to you all today. We all need a little bit more practice at the technical aspects of this.
Make sure it's set on speaker view.
Okay, Annie is asking, can you state whether any of the 19 deaths attributed in the June 29th variant report on the MSDH website occurred in unvaccinated individuals, or were they all vaccinated? And if there was a death in vaccinated individuals, does MSDH know which vaccines that were used? So let's take the first part about the June 29th variant report. Dr. Byers, can you answer that?
Yeah, and I've got to look that up, and I'm trying to look it up in my data right now to provide that answer. So I hope to have it here in a little bit.
Okay, thank you. Then we'll be able to answer that. So Annie will come back to you, okay? From Dan to everyone. Dan with the New York Times. Okay, that all county residents. All right, recently Los Angeles County recommended all county residents, not just unvaccinated, wear masks indoors. Is there any plan to recommend masking indoors for all residents? I think we've talked about that, but Dr. Byers, do you want to take that?
I'm sorry, I was looking up the data from the previous question.
Oh,
What
okay.
was it again?
Okay, so recently, Los Angeles County recommended all county residents, not just unvaccinated, wear masks indoors. Is there any plan to recommend masking indoors for all residents?
I'm gonna actually let Dr. Dobbs jump on that one, if he will.
You know, I still think it's a good idea for folks to wear masks indoors if they're in public spaces, and I do it myself when I'm out. I think it does make sense. I don't see us doing a mandate to that effect. I know that the city of Jackson still has it operational, and it does have benefit to prevent transmission. So I think it's a good idea. And especially, we do know if you're unvaccinated, you definitely need to be wearing a mask.
Yeah, Dan, that answers your question there. Definitely would need to wear a mask if you're unvaccinated. Just another reason to get vaccinated. Carmen with WLBT, can you talk about the partnership between the state and UMMC scientists studying sequencing to determine where and which variants are present in Mississippi? And I did actually touch base with them earlier today. And they are helping support our surveillance efforts, and they're also working with the CDC so that we can make decisions. We have 5 variants of concern, and these variants are defined by the CDC as having evidence for increased transmission, causing more severe disease or reduced effectiveness of some treatments. So we are working hand in hand with UMC. I got that statement from Dr. Robinson a little earlier. Carmen, write me back if that doesn't answer your question. I did talk to Dr. Anderson earlier. Okay, now it looks like I don't see any more questions. Does anybody have any more questions? I'll wait a second. Let me see here. Okay, well, I don't see anything. Oh, let's see. Anita Lee, Dr. Dobbs. When do you expect the Delta variant to be the dominant strain in Mississippi?
Yeah, good question. I would say that it is now the dominant strain in Mississippi, and I think Dr. Byers might can give us a percentage.
I would be surprised if it's not. It's certainly the predominant strain that we're seeing from our sequencing data, overwhelming. So I would be surprised if we didn't have it as the dominant strain in Mississippi right now. And I do believe I have the answer for the previous question from Annie. If we can look back at that one, Liz.
Oh, sure. All right, let me go back to Annie. All right, yes, we have it up. Can you state whether any of the 19 deaths attributed in the June 29th variant report on the MSDH website occurred in vaccinated individuals, or were they all unvaccinated?
So 4 of them were vaccine breakthrough cases. That means that they were fully vaccinated. These are individuals who ranged in age from 70 to 93. I do not have the vaccine type on my spreadsheet, but these were individuals who were fully vaccinated.
Okay, and let's see, do you know which vaccine or vaccines that were used?
No, I don't have the vaccine type.
Okay, now let me go back down here. So Carmen, okay, let me go back here. Okay, you want a detailed explanation of sequencing. That's what I'm understanding from you. And we certainly had nothing to do with UMC not speaking to you about that. But is that what I think that's what you're asking. Dr. Byers, can you explain how we do the genetic sequencing and when we do it?
You bet. So we do sequencing to determine the strain through a number of different samples that are submitted to us. And certainly we ask for providers to submit samples to us on individuals who are potentially reinfected, because that may be a variant strain, for individuals who are a vaccine breakthrough case, or those people who've been fully vaccinated and then become infected with COVID more than 2 weeks after the fact. We look at outbreaks. We ask providers from certain areas of the state to submit samples to us. We get samples from community testing, and certainly we're continuing to look at ways to ongoing ways to kind of broaden our reach for the samples that we do variant testing on. And so, those are the samples we get in. Our laboratory and the laboratories that we partner with look at those samples to determine if they are positive for COVID, and if they meet certain characteristics of that positivity. If the viral load is high enough, then they're able to have the material to do genetic sequencing so we can determine what strain of COVID-19 it is. And remember, we get lots of strains that come in. Not everybody is a variant strain, but certainly we are seeing the Delta variant as the predominant strain that we're identifying right now that's a variant strain.
Okay, hopefully.
I don't know how much
And-
more detailed to get, because
Well,
we have to pull in the lab at that point to really discuss the more detailed pieces of it.
Okay, well, hopefully that will do for now. Let's see, Sharon, is the Delta variant outbreak you are seeing mainly localized to Jackson, or is it spread among various counties? We kind of talked about this. Dr. Byers, can you touch on that?
Yeah, we've seen a number of outbreaks in the metro area. That's where we've identified them right now. But we are starting to see outbreaks in other parts of Mississippi as well. We've identified outbreaks among restaurants and restaurant employees, among schools, churches. And so I think we're at the beginning now where we're going to start to see some increases in the number of cases statewide. Again, we don't want to give the impression that this is limited to just the Jackson metro area. It is not. We anticipate that this is the dominant strain that's being transmitted throughout the state at this point. But where we've done most of our sequencing and where we've gotten most of our samples has been from the metro area.
All right, let's see. Okay, so I am not seeing any questions, any more questions. I can give you all a second if you want. And in the meantime, I guess that Dr. Dobbs, I mean, the main takeaway I think for you is that the people that are hospitalized and are dying are the unvaccinated people.
Yeah, no, exactly. I just can't reinforce that strongly enough. The people who are dying, the people who are hospitalized in Mississippi are unvaccinated folks. As we go forward, every death will be an additional tragedy because it was almost certainly avoidable. So please, if you're eligible to get vaccinated, go ahead and do it. If you have questions, talk to your physician, talk to your provider, get all the information you need to protect yourself.
And Dr. Dobbs, also talk about, because some people say, well, it's not FDA approved. Explain the process and why the vaccine is safe, even if it's not FDA approved at this time.
Yeah, well, it's been very thoroughly studied, evaluated. It's been given, hundreds of millions of times in the United States, and the safety data is really phenomenal. There are a couple of rare things, but it's really strong. We are hopeful and anticipate full FDA approval in the near future. I kind of wish they'd go ahead and get it done. Not so much because I think it says anything different, but I think there are some people who use that as a barrier. They're waiting on that, and I totally don't think it's a necessary step to wait. People are dying from COVID now. We know that it's safe and effective. So don't wait on a technical review when we have something that's going to save your life.
And let's see, I think I have another question from Sharon at the New York Times. Why are you seeing this trend among cases, deaths among younger people? I would assume because they're not vaccinated, but Dr. Byers, would you like to take that?
Yeah, it's likely because our highest vaccination rates are among our folks over the age of 65. We looked at that data a little bit earlier this afternoon, and certainly it looks like when you compare Mississippi rates to the national rates, we're significantly behind in a number of age groups.
Okay, thank you, Dr. Byers. And what's your takeaway from today? I mostly had you talking about the Delta variant. What's your takeaway? What's the one thing you want to impress upon people with the Delta variant?
Well, it feels very reminiscent, guys, of where we were in an earlier part of the pandemic, really about this time last year, when we were starting to see, outbreaks among group settings with a lot of transmission because we had a lot of susceptible people, and it feels like we're in that sort of same situation now with the Delta variant and the rapidity of its spread, especially among the unvaccinated individuals. And I mean, I don't know how many different ways we have to say it, but the path forward really needs to be the vaccination. And I really think that if we can get our vaccination numbers up, we can limit transmission, we can limit the emergence of the variant strains. And remember, the ultimate thing that we want to do is limit the severe outcomes, limit those hospitalizations, and limit deaths. And the way to do that is through vaccination.
All right, thanks to both of you. Again, I apologize for the technical difficulties, and I thank you all for joining us. And on behalf of Dr. Dobbs and Dr. Byers, I'm Liz Charlotte saying good afternoon. Thank you.
Thanks.